You're listening to the Mother-to-Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother-to-Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mother of four, and a teratogen information specialist. So what that means is I talk to people, patients, family members, healthcare providers, anybody really, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and cases of adoption. And an exposure can be anything. So nail polish, a chemical that you work with, a vaccine, even an illness. And on today's show, we have a special guest who knows a lot about exposures because that's also what he does every day too. Grant Houselog is the Assistant Director of the Iowa Poison Control Center, a position he has held since 2020. As an educator, Grant works with rotators and pharmacy students from multiple universities. He's an adjunct assistant professor at the University of Iowa and Drake University Colleges of Pharmacy. He's serving his second term on the Board of Trustees of the Iowa Pharmacy Association and as vice president on the Board of Directors of a local substance abuse coalition. He is involved with several other committees within national, state, and local organizations. He is a father of two, and we're very lucky that he's our guest today. Grant, welcome to the show.
Thanks for having me, Chris. Happy to be here.
Okay, so let's get started. Now, we did talk with a different poison center previously, but just as a refresher, can you tell our audience what is a poison center?
So a poison center is service that is of no charge to the public. We answer exposure questions, drug interaction questions. We receive phone calls from the public and healthcare providers. Sometimes we'll receive calls from law enforcement. So really, we are a team of specially trained nurses and pharmacists with oversight by physicians who are also boarded in medical toxicology. And so we are a team that answers the phone calls 24 hours a day, 7 days a week, 365 days a year. We never close.
Who can call a poison control center, and when do people typically call?
So really anyone can call a poison control center. We are a network of poison control centers. There are 55 poison control centers in the country. All U.S. states and territories are covered by a poison center. And so anyone, quite honestly, can call a poison center. There's a national 1-800 number. It's 1-800-222-1222. And that number is directed by the call from the caller's origination to their local poison control center. So it's a one number for the entire nation, but the call is directed to the local poison control center for the person who's calling. And they can call anytime, 24 hours a day. That's the service that we provide.
And what do people call about? So what are some of the general questions that your poison center gets?
Sure. So we get a lot of questions. Honestly, the majority of our questions are actually for kids. They're parents or guardians who are calling, and they're about exposures that happen for kids, and really under the age of 5 are very common, the most common, quite honestly. And so it's kind of the age at which kids are exploring and learning about the world around them. And so as we know that touching and tasting and eating and all of kind of our senses are involved in learning about the world around us. And so unfortunately, sometimes things happen where kids will take something and ingest it that they're not supposed to. But again, that's why we're here. We have special training to be able to identify and help parents or caregivers who call us with kids who get into things. So we get oftentimes calls with kids who ingest, we call them personal care products. So it can be anything from like lipstick or makeup or even lip balm, things like that. And it can be also things, pharmaceuticals, whether they're accidentally left out, whether they're a parent or a sibling or even a pet's medication sometimes are left out. And these kids, again, they don't know because they can't read oftentimes that they're probably not supposed to be eating whatever it is. And so it ends up in their mouth. And the parents or whoever is watching them will be giving us a call. And most of the time, we are able to safely manage these kids at home. We kind of have our send-in limits, as we would call them, and if we need to send somebody in, then we'd recommend, whether it's the ER or urgent care or something like that. But we have lots of information that we use to determine the severity of the type of the exposure and if something further needs to be done. And oftentimes, even if we don't need to send somebody into the ER, we will do what we call a callback or a follow-up at home. And so we'll actually call the parent or whomever at home in a couple of hours, or just kind of depending on whatever the exposure is, or whatever seems appropriate for the type of exposure that we're concerned about. And we'll manage, again, a lot of these kiddos at home. We also help manage those who are intentionally ingesting things. Sometimes that is to harm themselves. Sometimes it's a therapeutic error, so they're not trying to harm themselves, but maybe they took more than they were supposed to because they didn't understand the directions. And so these patients end up in the ER, and we help the providers that are caring for these patients directly bedside. And it can also be something more environmental. So we're coming into kind of the summer months. It's swimming pool season, and so there's a lot of, swimming pool, like chlorine type inhalation, so it can cause some breathing issues where people will start coughing, and it might make your eyes water and things like that, or drinking pool water, or fertilizers or weed control, things like that, things that happen outside. We even help with questions that are related to mushroom ingestions or other plant ingestions. So really, we have a lot of breadth to our knowledge base, and so we are able to answer lots and lots of questions for people who call us.
Yeah, that sounds like a really wide range. That's awesome that there's so much expertise and, ability to get some of that information for people who call. That's very cool. So along those lines, what is the most interesting question that has come into your poison center?
So it's kind of hard to narrow it down, but honestly, we've had several very interesting calls over our poison center's existence. But one thing that actually came to mind is we had a patient that had ingested the eggs of a garfish. And if you look up online, there are plenty of things you can find that say that these gar eggs are poisonous, they're toxic, and things like that. And so we had a husband and wife who had ingested these gar eggs, and they developed sort of symptoms, GI, nausea, vomiting, abdominal pain, cramping, things like that. And these patients were actually evaluated in ER. Thankfully, nothing significant really happened other than those types of symptoms. But this type of exposure was exceedingly rare. And when we kind of did some background information on possible previous exposures, what sort of symptoms do we see in humans when these garfish eggs are ingested, really the only case report that we could find at the time was published in 1850. So this happened several years ago. And so at the time that this happened, it had been well over 150 years that anything like this had happened. So it was exceedingly rare, but these types of things happen. Sometimes we'll have, people call us, and whether they're in, some sort of like Greek fraternity, sorority, things like that. Maybe they're ingesting things, sometimes on a dare. It's honestly very surprising sometimes, and it just when I think I've heard it all, something else can take the cake on it. So.
Grant, this is the first time in the history of this podcast that I have some homework to do after this. I am absolutely going to go look up Garfish because I've never heard of anything like that.
Yeah, they're really not an attractive looking fish, so let's put it that way. So I don't know why someone would want to eat the eggs, but anyway.
Yeah. A delicacy. Oh my goodness. Okay,
Yeah.
That's a good one. Okay, so let's look on the other side of things, something more common, obviously. Actually, in terms of things like pregnancy and breastfeeding, we too, get that whole range of exposures. And some are so common that sometimes it's a little surprising that people have questions about them. So things like hand sanitizer, for example. So sometimes we'll get the question, and of course, we want to know as well, can someone use too much hand sanitizer on their hands? So they're using it as directed on hands as a sanitizer. Can you use too much when you use it that way?
It all boils down to using as directed. So, the manufacturers have studied what's an appropriate amount to use, frequency of use oftentimes. But, can someone use too much? In reality, alcohol, the ethanol, or what's actually the sanitizer part of hand sanitizer, very minimal amounts can actually be absorbed through the skin. So I don't expect problems unless people are using exorbitant amounts, such large amounts, and they're basically dousing their hands over and over and over. I honestly would be more concerned with possibly irritating the skin than anything else, because the alcohol is very drying. So patients may develop, a skin rash or things like that where the skin's really dry. That would be probably my bigger concern, quite honestly, with frequent applications of hand sanitizer.
What happens when somebody ingests hand sanitizer?
Sure. So in the United States, most hand sanitizer is made with ethyl alcohol or ethanol. And it's the same type of alcohol that are in alcoholic drinks. And so we can actually see cases where people who are unable to maybe purchase alcohol from like a liquor store or something like that may turn to the over-the-counter aisle and purchase bottles of hand sanitizer and drink it for its intoxicating effects. In adults, most often we don't see significant problems other than those symptoms we would expect with someone being intoxicated. In children, though, in addition to those types of effects where the child may look intoxicated, and sometimes the hand sanitizer exposures are very common in kids, and we tell parents, watch for, slurred speech, difficulty walking, things like that. And oftentimes we're met with, well, they can't really walk very well anyway. And so it's kind of anything that's out of the ordinary. So those are some of the more obvious symptoms that we can see in kids. But the bigger concern with kids is that alcohol can actually lower their blood sugar. So they can become what we call hypoglycemic or have a lowered blood sugar. And that's just because their body isn't able to keep their blood sugar elevated with the way that the alcohol is being broken down in their body. And so depending on the amount that's been ingested, if a child's ingested this accidentally, we actually do lots of calculations. So our specialists have lots of math that goes into determining whether somebody can be watched at home or sent in. If this is something that we can watch at home, a child ingested a taste amount or some amount that is less than the amount that we would recommend sending them in, We actually recommend that the child ingest or eat something starchy. So those are like bread or chips, some sort of grain or pasta, something like that that's starchy, and also something sweet. So, candy or a sugary drink or something like that. And what that does is it keeps their blood sugar up. And the sugary drink or food raises their blood sugar immediately, very quickly. And that starchy food, the bread or whatever, takes longer for it to be broken down by the body, but it also acts as kind of a sugar as well to keep the body's blood sugar up. And so, it takes longer, and while the body's getting rid of the alcohol that had been ingested, we're able to relatively keep these children safe at home, watch them, and we'll usually follow up within an hour or so just to see how the child's doing, and then possibly make further recommendations from there. But in children, that's the bigger concern, quite honestly, is that it can lower their blood sugar.
Good to know. Something else we get commonly, and actually we had a podcast episode about this, episode number 40. What about household cleaning products?
Sure. So household cleaning products can be broken down into several different categories, whether they're laundry detergents or like wall and floor cleaners, disinfectants, toilet bowl cleaners, bleach, things like that. So everything has a point at which it can become toxic. There's a saying, it's not the substance necessarily that causes the poison, it's the toxicity. It's the dose that makes something the poison. So these types of cleaning products, disinfectants, most often, and this is not necessarily a generalization because each exposure is unique, and so we would always recommend that someone call the poison center if there's concern that something like this had been ingested. But in general, a lot of our kind of general household cleaning products, if a kid gets a very small taste, they tend to do pretty well with it. But that, again, is a very broad generalization. Well, the problems come from like oven cleaners or toilet bowl cleaners, some of those that are very strong, corrosive type cleaners. So we do get worried about those types of things. Even other floor cleaners, if the wrong type has been ingested or has gotten on their hands, on their face, can cause burns and things like that. So again, if there's ever a concern that something may have been ingested, we always recommend calling the poison center. Again, we're a free service to the caller, and we have the specialized training, and we have lots of resources at our disposal to determine what is actually in this product and if there's anything we really need to be concerned about. Because we look at like the safety data sheets that come with a lot of these cleaners, what sort of concentrations, what sort of pH, or is it acidic or is it basic? So these types of things we look at, and we make determinations from there. And again, if we do keep these kiddos at home, then we'd like to do follow-up calls and just check back on them, make sure everything's still going okay.
And there's a good likelihood that, whatever question that I have or somebody else in the public has, a poison center has heard it before. Unfortunately, these things happen. Like, everyone tries to be really conscious, right, about their cleaning products, about their meds and stuff like that. We're all out there doing our very best. I really, really believe that. But at least my little kids, are fast. If I leave something there, it's off that counter, it's spilled. And like you said, in their mouth, you said it in such a nice way. Kids are exploring their world through eating, mouthfeel, hands, and stuff like that. Meanwhile, I'm just like, don't spill that, don't do that. But it happens.
Exactly. It does. It definitely does happen. And we always try and reassure people who call us, the parents, the grandparents, whoever, the babysitters, if they call us, like you said, odds are we have not heard, this isn't the first time we've heard this question. But for the parent or the person calling us at the time, it's scary. It really is.
Yes.
Because you don't know. Believe me, I've been there. You don't always know what happened, or you don't always have the answers that we may ask. And we will ask a lot of questions to try and really get a good feel for what the scenario is. But we really try and reassure the person calling us that, we've had this call before. This is what we can expect. These are things that may be out of the ordinary and things that are more concerning, and this is why you should take them in if these types of symptoms happen. And a lot of what we do is really trying to help ease the minds of the caller. Again, because you said, we've gotten a lot of these calls before, but for them, that's probably the first time they're ever calling us, or the first time that's ever happened, or it's just, again, a scary moment for parents. And so in that first phone call we can hear panic. We can really hear panic in the voice of the caller. And so not only providing the recommendations, but really trying to help ease their mind. So that's always kind of a gratifying moment, being on our end of the phone, is knowing that we've not only helped keep these kids at home and keep them safe, but also help the parents feel more at ease too.
I agree. And I've used the Poison Center before. Again, I got 4 kids and, all of them were little at some point, and it really is. It's so different from being on the phones, which is what I do, but then having someone say, hey, listen, we've heard this before. This is what we're thinking of. We're worried. We're not worried, whatever the case may be. Like, you're getting the authority. And it does give you that peace of mind. So thank you for that. Thank you for the work of all the Poison Centers. And before you go, what is the final thought that you would like to leave our audience with?
So I would just like to emphasize the point that Poison Centers are here, available 24 hours a day. We are specially trained in managing poisonings and exposures. If you have questions, even if something hasn't happened, feel free to call us. We are here 24 hours a day, 7 days a week. There's the 1-800-222-1222 number, the national number. You will get routed to your local Poison Center, and our specialists are happy to answer questions for you. We really get a lot of exposures, thousands upon thousands of cases each year, and so you're not alone. Even though in that moment you may feel like things have happened with my own kids where I've had to call the Poison Center myself because even though I am trained to do this, there's always that what if? Am I thinking about this correctly? Because now I'm the parent and I'm not the specialist.
Right.
And so I want to get that reassurance. And so even though, I do this every single day, I call myself. So parents, you are not alone. I promise you. And there is no judgment passed here. We are here for you, and we are here to help anytime you need us.
And put that number in your phone, because I know that if it's an emergency, I'm not thinking clearly. I just want to be able to open my phone and just press a button and get to the Poison Center as soon as I can.
Absolutely. Program that number to your cell phone. I highly recommend it. That's a great point.
Awesome. Well, Grant, thank you so much for being with us today. It was a pleasure to have you on the show. And again, thank you for the good work that you and all of the Poison Centers are doing all across the United States. Give them a call. They're there if you need them.
Thank you, Chris. It's my pleasure to be here. Happy to talk with you.
And that'll do it for this episode of the Mother to Baby podcast. As always, remember that you can find us wherever you listen to your podcasts, so like iTunes, Spotify, Audible, or anywhere else. If you have an idea for the podcast, or if you want to be on the podcast, we want to hear from you. So feel free to email us at contactus@mothertobaby.org. And of course, the Mother to Baby service is here to answer your questions about exposures. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can find us on our website at MotherToBaby.org. There, you can chat with a specialist. You can also find our hundreds of fact sheets on many different types of exposures. You can also find our baby blogs, other information pages, information about our pregnancy studies, and of course, podcast episodes. So until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.